Today marks International Safe Abortion Day, where various NGOs and activists unite to demand universal access to safe and legal abortion. The United Nations experts have reiterated the need for dignity and freedom of choice for women and girls. All right, so for more on this, we are now joined by Dr. Tlaleng Mofokeng, who is a UN Special Rapporteur on the right to health, as well as Pontsho Pilani, Soul City Institute Advocacy Manager. Good morning, ladies. Thank you so much for your time.
Good morning, Ms. Chaba.
Now, firstly, while sexual and reproductive health rights are recognized as priorities in some countries, many others continue to neglect these vital rights or face potential setbacks. Firstly, let me start with you, Dr. Tlaleng. What is your thought on this?
So it's important, of course, as the expert on the right to health for the UN, to firstly commemorate International Safe Abortion Day, which is the 28th of September, but also World Contraception Day, which is the 26th of September, because we know that for many people around the world, their realization of the right to health remains a very distant goal. And when you're talking about sexual and reproductive health, which is really integral to the right of everyone to health, we know that there are many obstacles that stand in their way in the level of clinical care. So when they are seeking services, the pills and the medications they need may be out of stock. Doctors and nurses may not necessarily be able to assess them for their contraception need when they have other chronic illnesses and other chronic medication that they are on. But we also know that at the level of health systems itself, we're actually lacking modern contraception. We are lacking timeless delivery of these commodities. And of course, in the underlying determinants of health, it takes very long for some women and girls to finally reach a clinic to get quality services. When you're thinking about people in the rural areas, migrant women, women who may be in an irregular migration status, right, who do not have a proof of address, that their contraception needs get disrupted. So there are many challenges that lie ahead for people, but also we know that these are pre-existing, and so we need to bring even more attention to them.
All right, but surely abortion cannot be considered a form of contraception. What are your thoughts to this, Pontsho? And with all things considered?
Yes, thank you so much. I just want to reiterate that this myth that abortion is used as contraceptives is actually a Christian right-wing myth that is perpetuated against access to abortion across the world. And we've seen it creep up in the US, but also in other parts where the right-wing politics are mushrooming more, including here in South Africa. So abortion is never actually used as contraceptives. And we as Soul City Institute for Social Justice see abortion as healthcare. It's the same as going to a clinic to get your high blood pressure medication. It is a health service that should be realized, particularly for us when we look at our constitution that really talks to sexual reproductive health rights as a constitutional right. So safe abortion is a human right, and this is something that we see that there's often barriers that a lot of people who are pregnant face in accessing safe legal procedures. And we're saying that we need to do better to ensure that safe abortion services are available for women and people who are pregnant when they want that service, and across all public and private health facilities.
Yeah, and given that abortion is legal in South Africa, why is it that the rates of unsafe abortions is still so high? Especially, I mean, we are running a poll question this morning around the shame and the stigma associated with abortion. I don't know what your thoughts are there, Dr. Tlaleng.
Yeah, so I think we really need to be careful not to repeat, the misinformation around what abortion is or isn't. It is a valid form of medical care, and we have trained nurses and doctors who have the clinical skills to be able to do that safely for people who require it. And I think our own Ministry of Health has a lot to answer to about why the statistics are that they, despite almost 30 years of the Trace on Termination of Pregnancy Act, which gives the details of who what, where, when, and how an abortion can happen in South Africa, we still find that more people are having unsafe abortions in South Africa. We have a legal framework in South Africa, so no abortion can ever be illegal in South Africa because we have a legal framework that makes it illegal. The question is that abortion safe or unsafe? And unfortunately, more people are having unsafe abortions than safe abortions because definitely the stigma question you speak about is very, very important because people have internalized stigma even before they come to the clinic, even though they may need the abortion themselves. They are already judging themselves and having a sense of self-loathing. So when a healthcare worker or an admin clerk or a security guard at the hospital judges them, discriminates against them, they think, you know what, maybe I deserve that because I'm here for something like an abortion. So we ought to really include all these people that patients come into contact with and define them also as allied healthcare workers because they are important to understanding not just the Patupili principles, but they need to understand dignity, they need to understand confidentiality and privacy because many people will tell you, I'm not going to the clinic, even though they have information, because if I go there, very soon, the reason why I went to the clinic will be all over the village or it will be all over the township where I stay about why I went to the clinic. So we need to improve not just information, but the quality of care that people receive. And so this idea around dignity is really, really important because dignity forces us to really think about patient-centered care and not just physician or doctor or nurse-centered care. We need to think about what is it that our clients and our patients need in that chain of service. And it's not just what happens between the nurse and the doctor with their patients. It's the entire chain of service. And so that stigma affects every single person, including the person who will give directions to that woman about where the clinic is, who will open the file for her for that particular clinic.
All right, Doctor, we speak about women, but what about children? I mean, the laws in South Africa say that girls at any age, as young as 12 years old, can have an abortion without the consent of their parents, which is a little bit disturbing if you take it into consideration that this may be harboring a system of abuse. There's no 12-year-old child that should be pregnant, and we consider it a legal right for her to go and have an abortion because we're protecting her dignity. Something is off.
Remember, there's a reason why she got pregnant, right? So to then focus on the health need of the child as the big catastrophe is wrong. Children do get raped in this country every single day. And I can tell you, as someone who's an abortion provider herself, I spend more time jumping legal hurdles to try and get people, adult women, right, care timeously. And we jump too many hoops for people who have a legal framework to make this happen. What does happen, and the Person Termination of Pregnancy Act and any other medical procedure will tell you that parental guidance is important, but no one can impede anyone else from getting treatment. So even you now, your parent can impede you from getting treatment, no matter their thoughts or feelings about what care you require. And remember, for a 12-year-old, an abortion is safe and one of the safest medical procedures. It's safer than getting pregnant and giving birth and being forced to give birth. And so we ought to think about the alternative. If we are not going to give services to people, and including children, who are raped and sodomized and go through all of the horrors that they go through, and that one medical procedure can actually turn their life around and give them another chance at life, give them their right to go back to school and education. Remember, many presidents in this country have said that when young girls get pregnant, they must go to some island somewhere, right? So their rights to education, their right to economic participation, there are many other rights that get unlocked by the right to health. And so we cannot withhold services and care for children simply because they are children. That contravenes even their rights of the child, even through the UN. And when you go through medical training, there is informed consent, and we know the different steps that we take when we give information. We know when to seek advice. We know how to even say to a young person, for example, who's 13, who's 14, who's 15, who's 16, who's inquiring about different health needs, and how we go through that process of counseling and information giving. So it's very important to remember that what happens in the consultation room is evidence-based, is based on ethics, on bioethics, on medical ethics. And so we would not do anything that would contravene even our own professional standards of practice as healthcare workers. And our Choice on Termination of Pregnancy Act is very clear.
Okay, doctor, I'd like to bring you in here, Ponso, because while we're protecting the rights of the children to access to education, and I think that the doctor made some very valid points, but if a 12-year-old falls pregnant, surely her body is already a crime scene.
It is more likely that that is happening. And instead of impeding access to abortion, what the questions need to be is around what happened to that child before she fell pregnant, right? It is because of the statistics and the incidences of statutory rape and sexual violence in this country that even our Choice of Termination of Pregnancy Act starts at the age of 12 to enable that in cases of sexual violence that, as Dr. Tlaleng has said, that it is safer for a 12-year-old, a 13-year-old to terminate a pregnancy than to carry full term and give birth. And so if that body is indeed a crime scene, as we know that it is, then we need to then talk about something else, which is the medical healthcare workers' responsibility to do a J88 form and to take it upon themselves to I don't want to say convince, but to have a conversation around sexual violence and get to a point where if there was sexual violence, it is documented clearly. We at Soul City, we run what we call Soul Buddies Clubs. Many South Africans will know about it. And in one case in Limpopo, we discovered the Soul Buddies Clubs are for 8 to 14-year-olds. And we discovered one of our buddies was pregnant, and as a result, with a intervention from the school, from child organizations that deal with this, we went to talk to the family and we tried to explain to them that this is likely to be sexual violence, and it was. And so it was dealt with from that point of view. But to say that because sexual violence happens, we should stop the Choice of Termination of Pregnancy Act from being implemented the way that it is set up for reasons, including sexual violence, would actually be impeding the rights and the bodily autonomy of the 12-year-old herself.
All right. So while we're talking about the rights of women to have abortions, let's talk about cost and the access to such services, because, I mean, as it stands, having an abortion in this country is an expensive process. It's not an easily accessible service. So what do you say about this, Dr. Tlaleng?
Costs remain one of the most impeding factors, and for both private and public sector, and for all women of all socioeconomic backgrounds. And I think there is, of course, more people who are working, who can afford to save money for private care. But even that, the fact that people must still save money for accessing private services for what is a basic primary healthcare service that should be available for free in the public sector is problematic. And so for me, what we need to talk about is what is the role of the state and its obligation. And in this instance, the state has an obligation to not only have this Choice on Termination of Pregnancy Act, but to also have a budget that supports its realization. It needs to have a budget in terms of training healthcare workers, because a lot of the times people go to the private sector because of the long waiting queues. You will arrive at a clinic in the first trimester, right? That's within the 12-week period, maybe at 8 weeks, but you will be given a date that's 8 or 12 weeks later for you to actually have the procedure. And that puts you well into the second trimester. And so those kinds of delays are what makes people then actually seek services in
that
an
are unsafe.
Exactly. Or they then go to the private sector, which has additional costs. The problem in South Africa that I've been talking about, and for years, and even Helen Rees has even resigned at SAPRA, is please can we get generics registered? Can we have a timeless turnaround time for generics? Because what also makes this expensive is that one of the medications that's made in France has very high costs, but also import tax is very high on it because there aren't any other generics registered in South Africa. So the idea of access to medicine as a human right is very important, especially when you are talking about abortion and the cost of services. So my own advocacy, for example, at the UN as a special rapporteur has been around access to medicine, the fact that people have a right to scientific development. And so when we talk about World Contraception Day, when we talk about World Day of Safe Abortion Access, one of the things we talk about is what is the role of business. And business has a role in human rights and is to remind them of that role. So we talk about the state, which is the government. We're talking about business, which is a third-party entity. And we ought to be making sure that the health system is really geared up to support patients. And this procedure should be free, timeless, dignified, and of quality in the public sector.
All right. So while we're talking about the role of the government, also I think it's important to also speak about what is the role of the government in eradicating these unsafe abortion facilities. I mean, we see all over town, Joburg, CBD, wherever you go, there are these posters that are promoting unsafe abortions, get a cheap abortion today, you know, and mind you, there are no considerations into how far the pregnancy is. So what role is the government playing in curbing these unsafe abortion facilities?
I think the question we should ask is why we do have unsafe abortion or illegal unsafe abortion facilities, right? It goes back to the idea around access and the ability for anyone to walk into a public health facility and be able to access abortion services. However, you know, at Soul City, the Department of Health is one of our partners, and these are some of the issues that we really do advocate for. The liberalization of access to abortion, training more doctors. You know, one of the other issues that has been a big advocacy point has been around ensuring that abortion services, the ways in which abortion is done is actually done in medical schools instead of only after qualification as a doctor or as a nurse, for it to be integrated into the curriculum at a university level, because we do know that that will help. And also it could actually also eradicate some of the stigma that is carried by people because of the society that we live in around these services.
And speaking of the society that we live in, before I let you come in there, Doctor, I don't know. I'm all for human rights, but I don't know that we can live in a world where 12-year-old kids are permitted to have abortions without the consent of their parents, because we are concealing abuse. How do we draw the line?
No, you're not concealing abuse. Remember, we work in a network of providers and services, and often the work we do leads us to actually be the first people as abortion providers, where people are for the first time saying, actually, this pregnancy is a result of an abuse. It's through our own counseling with the patient that for the first time, they are also coming to terms with how they got pregnant. And the services we provide then shift to emotional debriefing for that particular reason why they got pregnant in the first place. Because if there was no pregnancy, maybe they could have just put it at the back of their mind and say, this is something I will deal with whenever.
But what happens, I'm so sorry, Hukena Khanong, what happens next? I hear all the part about the counseling, but then what happens when you find that a 12-year-old is pregnant?
Depending on where we are in the process, we even have the police who will be there to start the chain of evidence, because they can often identify the perpetrator, especially when they are dealing with serial rapists, from the tissue, right, that we will then be using, and when you are doing the product of conception, they can use that tissue for DNA and actually link a rapist to, for example, serial other rapists, maybe in the area or even in the country, through DNA. But that, of course, needs consent of the person, and often they do consent to that. So we have police literally on our mobiles on standby. We have social workers on standby. We have legal practitioners on standby. So this is never like a once-off 5-minute thing. It takes time, and that's why we need more of us to do it, because it can take you 3-4 weeks, 2 months, just to get to the conclusion of the actual procedure from when a patient came in. And often they will come in and we have to arrange a place of safety, because remember, children are being abused in their very homes. So the very first people you want to give consent for this procedure are the very people who are raping these children. So absolutely not. The state ultimately is the custodian of children. The state has the responsibility to take care of children. And in this instance, we ought to also assess how is the home situation, and that's where social workers come in. And it would be wrong and completely immoral to have someone's rapist be the one that gives consent whether or not they can have an abortion. There are many other adults. The superintendent of the hospital can even give consent for even me and you when we are unconscious and we need life-saving intervention. So there are many ways of getting informed, proper consent, even for children.
Okay, this is such a big conversation, and I think we need to pick it up again. But that was UN Special Rapporteur on the Right to Health, Dr. Tlaleng Mofokeng, and Soul City Institute Communications and Advocacy Manager, Pontsop Ilane.